Why, hello there. I imagine that you are a bit tuckered out from your physical, but we are going to be needing to give you a physical and mental screening. Is this alright? Great. So, give me one moment. I'm going to open up my journal just to know what exactly it is I'm supposed to do to you. The assignments I've been tasked to take care of you. It can be very routine, but from time to time, certain patients or certain soldiers or certain candidates to become soldiers tend to have a more adjusted or customized sort of, what's it called, itinerary for their check. So yours seems quite routine. There's nothing special we have to take into consideration when it comes to checking you out, but for the first one that we're going to be doing, apparently it's going to be the physical. So the physical, we are going to be testing 3 of your senses, just the ones that we're going to be needing in order for you to be an apt soldier in the battlefield. We're going to be giving you an eye test, an auditory test, so we're going to be testing your ears and seeing how well they work. We're going to be giving you a smelling test as well. Is this all right? Excellent. So the first test, give me one more moment, is going to be, okay. So first we have to determine how well you can see, of course, because obviously you want your visuals to be sharp in the battlefield. You don't want to mistake someone's clothing to be of a different color than the color of your soldier's clothing, even though of course we're not in the Civil War anymore, but still you want to be able to identify your fellow soldiers from your not fellow soldiers. Otherwise you might get into a bit of trouble, to say the least. Now, for this test I have an eye chart. I want to see exactly how far and how well you can see determined from the letters. So let's see. Can you see the top letter? Great. Can you see it? Excellent. Just repeat out whatever letters that you see. Now how about this one? Excellent. How about this one? Excellent. How about this one? Excellent. How about this one? It's a little trickier. And you got it. Let's try one of these. If you can see below this line, that means you have some tip-top sight on you, and you could even be promoted to an air pilot if you so choose to. How about this one? Can you decipher what it says? Excellent. How about this one? It's a little trickier. And you got it correct. Now let's try this bottom row. This is where it gets very, very, very difficult. Now let's see. Not impossible though, but difficult. Let's see. How about this one? Can you see this one? How about this one? Excellent. You did mighty fine. Let's just put that chart to the side. Now what I'm going to be asking you to do, I'm going to be taking out my pen once more. I want you to simply, don't twist your head, don't move your head at all, but I want your eyes, just your eyes, to follow this pen around. The tip part, the metal part of this pen. Just follow it around. Just want you to follow it. See how you focus and how you focus on well. There we go. Now I'm going to go a little faster, honey. Okay? Just a little faster. Tell me if I'm going too fast, okay, honey? Great. Your eyes are doing so far so well. Now, let's go just a smidge faster. There we go. The purpose of that test is just in case you have to see a running target, you can easily hone in focusing on that target, and if need be, make your shot. So that was the purpose of that test. Now, let's test your attention. So once again, don't move your head, but don't move your eyes. For this test, I want you to look me square in the face, whether it be my nose, between my brows, on my chin, anywhere on my face. Just focus on one spot in the center right here, while I hold up both of my hands, and I'm going to be holding up both of my fingers as well, and I'm going to be wiggling either one finger or the other, and I want you to tell me which finger is wiggling. Is this alright, honey? Great. If ever you don't understand an instruction I've given you, please ask me to repeat it. Now, let's begin. Excellent. Excellent. Great. Now I'm about to move my hands. Once again, continue telling me which finger rather is wiggling as I move my hands. Excellent. Great. Now let's move it again. It's going to be a little faster. Excellent. You did it. Excellent. Let me just check off your results on those tests. You did mighty fine on both tests, and I must commend you for that. Now, for the next test, I'm going to be snapping my fingers around your ears. So, like such, I'm going to be holding both of my hands on the sides of your ears, and I'm going to be giving a snap like that. You tell me which ear you heard the snap in. I'm going to be going one at a time, and I'll give you enough time to determine which ear it is that you heard it from. Alright? Alright. So, let's begin. Excellent. You did fantastic. Now for the second auditory test, what we're going to be doing is I'm going to be whispering on either side of your ear a certain word, and I want you to tell me which word it is that I'm saying. Alright? Great. Let's begin. Lamppost. Lamppost. Correct. Mailbox. Mailbox. Correct. Platoon. Platoon. Correct. Churchill. Churchill. Correct. Car. Car. Correct. Lamppost. Correct. You're doing excellent. Let me get back on my seat and let me check off your results. You did excellent in both categories. Now, let me grab my scents for you. Here we go. Now with these scents, what I'm going to be doing is I'm going to be holding 3 vials up to your nose, and I want you to decipher for yourself which smell belongs to which category. Alright, if you can tell what the smell is. Great. Now let's go with the first vial. Can you smell what it is? Very good. Coffee. Now, let me set that to the side. Pick up the other one. Now can you smell which one that one is? Very good. Vanilla. Now, can you smell what this smell is? Very good. Lavender. Now you finished your smelling test. The reason for the smelling test actually is because in case you end up smelling like some sort of gas or any other scent that is peculiar and special to the battlefield, that depending on the direction of the scent and also the direction of the scent, you can avoid your soldiers or your fellow soldiers from going in that direction if in the case that you are presented with a position of leadership, in case, you know, your group leader ends up dying or is indisposed of in the moment. So that's why you just want your senses to be at tip-top shape for any circumstance that arises for you to be at your sharpest mental capacities. Now, when it comes to the next part number 2, your mental health screening. Now, the psychiatrists of today want us to be a little more stringent when it comes to the mental health screening, because World War I did present a lot of soldiers who went to the battlefield and ended up coming back in mental shambles. So we do want to be able to give you a proper diagnosis. Now I'm going to be asking you a couple of general questions to determine how disposed you are to being a good candidate to be a soldier. But of course, the psychiatrist you will be meeting with will be more in-depth with your answers. So let's go with the first one. The first question is your school life. How well did you do in school? How was your performance in school? Alright, I'm just going to write down some quick notes for the psychiatrist to kind of get a frame to work with. Now, did you make any friends, any close friends, any casual friends during school? Well, that just sounds peachy, honey. Now, for the next question, do you happen to have difficulties falling asleep? When you're asleep, do you tend to have a little trouble with your dreams? Okay. You can go as detailed as you like, honey. Don't worry. I'm here to listen, but I'm going to be writing shorthand. Now, what is your marital status and how well do you think you are having a relationship with your significant other, if you do have a significant other? Yes, that could include just someone that you are going out with, not just someone that you're married to. Okay. And do you feel like you get along with your significant other in general, or do you feel like there's more problem than solution? And if there is more problem than solution, how exactly do you resolve that problem? Excellent, you're doing just fine, sweetie. Now, when it comes to your income, how much money do you make a year? Yes, income is correlated when it comes to mental health. It's been proven in many studies. Of course, it's just a theory because most empirical studies are just theories, but this study has been made time and time again to prove that income does relate to mental health. Of course, if you don't make that much money, you're not going to be all that happy. So, okay. And have you had your job for years now, or have you lost employment and had to regain employment? Okay. And how did you resolve that matter? Excellent, excellent. Well, now that I have all of the answers I need to ask, or needed to get, I'm going to give you a couple of vaccines in your arm. We'll end up getting more vaccines later on once you've been approved to be a full-fledged soldier on your bomb So we're gonna just do the ones on your arm for right now. We're gonna do the Vaccine. So if you wouldn't mind rolling up your sleeve, I just need to get a nice little shot at your bicep. Or no, this is tricep, bicep. Okay, so let me just collect the first vaccine. Now, okay, let me just collect some wipes. Just scrub down your arm, make sure that it's all sanitary. Would you like an ice cube? It's my own little secret. If I numb the area, it's not gonna hurt as much. So, would you like an ice cube? I won't tell anyone. It won't make you seem weak in my eyes. I'm gonna just press the ice cube against your arm for a good, let's say 15 seconds. So 1, 2, 3, 4, 5, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, 13 Mississippi, 14 Mississippi, 15 Mississippi. Now, brace yourself. 1, 2, okay. And now we're going to just pull out the vaccine. Excellent. Just 2 more times now. Let me just scrub down the area again, just to kind of soothe down whatever. Let me just put on the ice just for 5 more seconds to numb it. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. And now I'm going to give you the second vaccine. So 1, 2, okay. And there we go. Now for the third vaccine. Once again, let me just scrub down the area just to make sure it's sanitary each and every time we go forward. 5 more seconds with the ice cube. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. And now for the last vaccine, and then off you go to enjoy the rest of this beautiful day. 1, 2, okay, and you are all set. Let me just get you a Band-Aid just to get all of that just covered, and you are all set. So have a wonderful day.